Hey guys, it's Miss Landry, and this is an introduction video to kind of get you started in clinical psychology. We're going to be talking about, it's also called abnormal psychology, but before we get started with it, I want to kind of posit a question to you. What do you consider abnormal when it comes to behavior? Is what you consider abnormal the same thing that I would consider abnormal? So, we're going to be questioning how we define what is normal. So, I love memes, as you know, and here's our first one. What if I told you that normal is really a perception? And we're learning, right? That perception is different for each person. So, if it's an illusion or a perception, think about a spider and a fly, right? So, what is normal for the spider, which is that web that they create, is chaos and death and something to be feared for a fly. And so when you think about it, maybe normality and abnormality is more a question of context. So I have a few questions to ask you. How would you define abnormal behavior? And rather than come up with a definition, I want to ask you a few questions about it. Who gets to define it? Is it me? Am I going to define it for you? Is it psychologists that define it? Does a priest define it for you? Is it your parents? So, kind of think about who's defining what is normal behavior. Is it different based on culture? If you were to go to another culture, would there be behavior that is abnormal? Probably. You would consider it abnormal, but in that culture, it is completely normal. How about by age or gender or religion? So remember that we're talking about context. And it's easy for us in America to always kind of go straight to that Western, cisgendered culture, but that is not the case for the entire world. And so I really want you to kind of broaden your thought about what is abnormal. There was a movie I would have loved to have shown you called One Flew Over the Cuckoo's Nest, and it's about lobotomies, actually, back when we used to do lobotomies. And this was a character in the movie, and he was kind of crazy, but had such an amazing personality. And I love this meme again. It says, I'm going to try and act like a normal, happy, mentally balanced person today. Wish me luck. I think we all feel like that sometimes, don't we? Like, I'm just going to fake it till I make it. So, just a little bit of humor before we go on. Let's talk a little bit about the history of abnormal behavior. Believe it or not, they used to do this thing. I don't really know how to pronounce it, trephination or trephining. And they used to actually take out parts of the skull to release demons and the pressure that was in the brain. And there were four different ways they do that. If you look over here at this side, you can see here they would scrape it away. So they would basically cut off the scalp and then they'd just start scraping the bone until they got a hole. Two, they would create this groove around it. They actually had these machines that would it was almost like a huge hole punch into the brain. They would bore it. So it's a machine that would bore through. It was like, if you've ever seen a bore machine, it's like they take samples of the ground with them and it like goes down and it basically cuts through the bone. Or they would do these intersects, right? So they would basically score the skull like so, and then they would punch out that square. So here's an example of a skull that was found with some examples of trephination. And the person who wrote about this was actually Paul Broca. And you just learned about Broca's area. If you remember, that's the ability to create speech on the left side of the brain. And Paul Broca actually wrote more about this practice than he did about language. So he was very, very interested in not only why they did this, but how they did it. And I just thought that was kind of interesting. So that's what they used to do. Hippocrates, back in Hippocrates' time, he was the first one to really indicate that abnormal behavior had a biological component. So it wasn't demons, right? It's not just demons. He argued against the idea of someone being needing an exorcism, I guess you could say. So he called them humors. And if you look, I'm going to move myself here because I'm kind of in the way. But if you look, there were four humors. There was blood, yellow bile, black bile, and phlegm. And they all had different parts to them. And when they were out of balance, you would show signs of your humors being out of balance. So, for example, if you were coughing, it was your phlegm that was out of balance, right? And so here's a picture from his time. Go back. From his time, you can see that there are the four humors. And but again, it's the first time that a biological component was really discussed as to having a, a background in behavior, in abnormal behavior. Then we get into the Middle Ages and we go back to the religion. And basically, people who are showing signs of abnormal behavior are, they need to have exorcisms because demons have taken them over. And a lot of times, mentally ill patients were considered victims of this demonization and they were sent to asylums. Eventually, that idea gave way to witchcraft, in which they were no longer victims. Now they were actually the ones causing the problems. And so they were often killed as witches. So here are some images from that time period. You can see that they're trying to get this little demon here at the top out of this person. They also, there was, what did I want to say? There was a guy named Philippe Pinel, and he tried to make life better for those that were in asylums. He found that the way that they were treated was just horrific, which is true. And he believed also, like Hippocrates, that the illnesses were of the mind, and that's not because of demons, that there was a biological basis. And he would go into these asylums and try to create a more moral and ethical way of treating the patients. He would actually have dances for them because, as you're learning, social connection is kind of what keeps us sane. And so here's an image of someone who did a drawing. It's called Dance in a Madhouse from 1917. And you can see that they look like they're kind of having fun. The faces look a little creepy, but he's the guy that really started that process of trying to treat people with mental illness a little bit better than they were in the Middle Ages. Modern times, one of the first ways that we started to change how we treat abnormal behavior is through what's called the medical model of mental illness. And so I want to pull up this image of a brain. And this came about because of syphilis, believe it or not. So syphilis, it was found that people who had late stage syphilis actually started to show a lot of behavioral issues. This is a brain scan of somebody with late stage syphilis, and his personality completely changed. And I think you can see this right here is what we call a gumma, GUMMA, and it's basically damage to the brain tissue. And you can see, like, look at the center at the where the corpus callosum is, like it's pushing against that. And so, as you know, this can cause some pretty major psychological changes. And so they started to replace asylums with hospital care. And we created kind of a medical model of mental illness where, okay, what is the symptoms? How are we going to treat it? And it really kind of went back to that biological basis. We still use that terminology, right? Like people are diagnosed, and we call it an illness. And so I want you to think about how terminology can really affect how people look at other people. Like if I say to you, someone has a mental illness versus someone's psychotic, it has a very different ring to it. Nowadays, though, we have a different way of treating mental or abnormal behavior. Sorry, I'm just trying to click here. And that is through what we call the biopsychosocial approach. And this came about because psychologists believe that with the medical approach, there was too much emphasis on biology. It's all about illness. But what about culture, society, and even individual differences? Think about your family, and you might have a sibling that is very stressed out very easily, whereas you're a little bit more laid back. That can have a huge effect on behavior. There are two illnesses, or I should say, two abnormal psychological categories that are found throughout the world, and that is major depressive disorder and schizophrenia. I don't believe that there's an area in the world that is not touched by those two disorders. And even in different cultures, they have terminology for different types of disorders. Latin America has susto, which is really being afraid of black magic, and you have a fear and an anxiety of it. In Japan, I'm not really sure how to pronounce that, but basically, it's a social anxiety about how you look and whether or not you're going to blush, and are people looking at your eyes, like eye contact. So every culture has its own kind of bent towards a certain type of disorder. So here is a kind of a summary of what biopsychosocial is, that type of treatment. So you have to look at it under three lenses. It's impossible to pull just the biological influences of a disorder. So let's say we're talking about anxiety, or let's just say post-traumatic stress disorder. This one might be the easier one to talk about. Post-traumatic stress disorder, does it have a biological influence? For example, yes, the brain chemistry has changed, right? The neurotransmitters are acting differently than they were before the trauma occurred. But you can't pull that out from the psychological influence. What was the trauma? Are there perceptions and memories that are affecting the people? Of course there are. And then you also have to look at social cultural influences. So are there expectations? I think about this with soldiers when they come back, there's certain expectations of them. And are they feeling like they can't uphold, what they feel is their role in society? So you really need to take all three lenses and put it together to get a complete picture. And we do that using something called a DSM-5. I know you've heard me talk about this before. It stands for Diagnostic and Statistical Manual of Mental Disorders. It's a mouthful. Just remember DSM-5. And basically, it's kind of the Bible, right, for the psychologist. They use it to diagnose disorders. The terminology is similar to the World Health Organization's disease classification manual, which is good because then you can use it for, they have common language. It's not perfect though. When they tested it in field trials, they looked at a few different disorders, and one of them was really good. So PTSD, childhood autism spectrum. If one doctor diagnosed the patient with one of those disorders, there was a 70% likelihood that another doctor would also diagnose them with the same disorder. But for things like antisocial personality disorder or GAD, general anxiety disorder, it got as low as 20%, which means if one doctor diagnoses you with antisocial personality disorder, there's only a 20% likelihood another doctor would. So you can see that this manual is not perfect. A lot of psychologists believe it is too broad. For example, in the area of ADHD, attention deficit and hyperactivity disorder, it feels like a lot of psychologists feel like they're pathologizing daily life. And like, kids have a lot of energy. Kids can be very distracted. And are we making it into a pathology when maybe there isn't one there? This is an example of how it could be used. So if I wanted to decide if you had insomnia, I would take a look. Here are the different things that have to be met in order to be diagnosed with insomnia. So things like it has to not be due to drug use. It happens 3 or more nights a week. For at least 3 consecutive months. So there's definitely kind of a checklist that you have to go through as a psychologist or a psychiatrist in order to diagnose someone. And this is all in the DSM-5. We're going to be practicing with it. So yay, it'll be fun. I think that is about it. If you have any questions, please feel free to drop them in the comments. Otherwise, I will see you guys later. Have a fantastic day.